Buenas tardes, es un orgullo estar aquí celebrando la herencia latina en los Estados Unidos, aquí con el presidente Obama y con mis colegas aquí esta tarde. Our ability to harness the resources and talent of the Latino community begins by celebrating the past and the ongoing contributions of American Latinos who have helped shape this country and who will continue to shape this country with the 50 million Latinos who now live here in these United States. For far too long, in my view, as Secretary of Interior, we have not told the story of the American Latino and the contributions that American Latinos have made to this country. We are changing that within the department as we move forward with creating a blueprint to make sure that the story of Latinos in all of its forms and all around the country is told, from the Revolutionary War to World War II to what we do today in modern-day America in arts and cultures and in all of the other efforts that we have done. In celebration of Hispanic Heritage Month, the Department of Interior will host the White House American Latino Heritage Forum, and there we will discuss how the legacy of American Latinos should be recognized, preserved, and interpreted for future generations. Today's part of the Hispanic Heritage Month and the celebration of Latinos is focused on the health and the importance of health in our communities. We have a star lineup here that will speak about how our diets are so important, a great initiative of First Lady Michelle Obama and the President. My quick role on this is that it is also important to remember that having kids play outside is a very important part of our agenda. And so we in the Department of Interior have focused for a long time on making sure that young people, especially urban people or young people, have access to outdoor recreation. We know that outdoor recreation is one of the best ways in which people can engage in activities that keep them healthy. But we also know that besides doing exercise, what it is that you take in is very important in terms of your diet. And eating healthy is one of the most important priorities which President Obama has focused on. And the person who is in the front line of making sure that we have healthy diets and healthy foods is the great Secretary of Agriculture, Tom Vilsack.
Thanks, Ken. Secretary Salazar, thank you very much. And I want to thank you for putting the spotlight on getting young people reconnected with the great American outdoors. It's a tremendous initiative that Secretary Salazar has led in this administration under the President's leadership and direction. And I appreciate the fact that Secretary Salazar also mentioned the extraordinary work of the First Lady with her Let's Move initiative. Clearly, it is both calories in and calories out, and the First Lady has done a wonderful job of galvanizing people's views and attitudes about the importance of exercise and physical activity and proper nutrition. Our job at the USDA, the Department of Agriculture, is to make sure that we provide people with the proper information so they can make healthy choices. We started this process by redesigning the dietary guidelines to put more emphasis on fruits and vegetables, whole grains, and low-fat dairy. We also improved the women and infant children package that goes out to nearly half of the youngsters in this country to ensure that they get a good, healthy, early start. With the President's leadership and congressional help, we passed the Healthy Hunger-Free Kids Act of 2010, designed to redesign school lunch and school breakfast programs to make sure that they, too, are more nutritious. We've got several famous chefs here. Through the First Lady's initiative, we got chefs working with school districts to do a better job of preparing meals, and we've had a recipe contest, all designed to focus the attention on healthy eating. One of the things that we can do, and that we are doing today, is making sure that we have a better understanding of precisely what a healthy meal looks like. And so today we are launching the MiPlato effort, an opportunity to take all of the information that we have on healthy eating and the visual icon of what a healthy plate looks like, with half the plate fruits and vegetables, whole grains, proteins, and dairy, and making sure that it's available to Spanish-speaking individuals. We have a website, choosemyplate.gov, which outlines in great detail the entire campaign from the visual. In addition, we're going to provide additional information on precisely tips in terms of healthy eating, as well as additional brochures that are available that look like this, that provide tips and interesting information in terms of ensuring that families do a better job of making sure that they put healthy food on each and every plate. We're excited about this opportunity. We think it will make it a little bit easier for people to understand. The food pyramid, which this replaces, was far too complex, too complicated, not as well understood, not as easy to remember. This visual provides a very simple and easy message. Half your plate fruits and vegetables, protein, whole grains, and dairy constitutes a well-balanced meal. And if we do a better job of making sure that youngsters particularly have access to this, we'll do a better job of dealing with the obesity epidemic. And I'll conclude with this before I turn it over to the Surgeon General. 1/3 of our youngsters across the country are obese or at risk of being obese. This has an impact on their ability to achieve in school. It clearly will result in higher health care costs in the future. It will make them less productive than they would otherwise be in an economy that needs every single person working at their full capacity. And it's also an issue of national security, because we have an ever-shrinking number of people who are fit for military service. So it is important and necessary that all families across the country have access to the information to ensure that their youngsters make good choices, achieve at the highest level in school, are as healthy as they can be, are prepared to assume the responsibilities of contributing to this economy and making sure that this country maintains its safety. Someone who's on the front lines of making sure that all of America understands the challenges of obesity and how to deal with it is our Surgeon General, Dr. Benjamin. General.
Good afternoon. Thank you, Secretary Vilsack. It's a pleasure to join you and Secretary Salazar and our 3 wonderful chefs who you'll be hearing from shortly. There's perhaps no more serious a challenge to our nation's health and well-being than those that's posed by obesity and overweight. Since 1980, obesity rates in the United States have doubled in adults and more than tripled in children. And the problem is even worse among Black, Hispanic, and Native American children. We see the sobering impact of these numbers in the high rates of chronic diseases such as diabetes and heart disease and other chronic illnesses that are starting to affect our children more and more. The University of North Carolina School of Medicine reports that obese children as young as age 3 are showing signs of an inflammatory response that has been linked to heart disease later in life. So I've been pleased to work with the First Lady over the past year on her Let's Move initiative to reverse this trend within one generation. Both the Let's Move campaign and the National Prevention Strategy that was released earlier this summer have been working together to bring individuals, organizations, private industry, communities around the country, and others to develop solutions and to implement new programs. Together, by partnering, we have begun to improve school meals, provide greater access to healthier and affordable food, increase physical activity, and we still have more to do. So today's unveiling of MiPlato is a continuation of that good work. The goal of the National Prevention Strategy is to increase the number of Americans who are healthy at every stage of life, whether they are young or old, all stages of life. But for this to happen, we have to find a new approach to promoting prevention in our communities, since staying healthy depends on many factors that influence our health, such as active living, housing, transportation, education, the availability of quality, affordable food, our workplaces, and our environment. That's why this administration has launched this broad agenda to help Americans get healthy, live longer, stay well, and to thrive. One of the most important things we can do when it comes to our nation's health is to provide clear and simple information based on the latest science and evidence that's available, so that Americans can make their own choices, they can make their own decisions about what's best for them and their families. We're simply giving them the tools to help them. So instead of constantly telling Americans what they can't do, what they can't have, and what they can't eat, we're beginning to talk about what they can do and what they can do. And MiPlato is a new and simple, easy tool that will help them do just that. We want being healthy to be easy and to be fun, and that's MiPlato. Muchas gracias. So I will now turn it over to our White House chef, who helped the First Lady create her famous vegetable garden, Chef Sam Cass.
Thank you, Dr. Benjamin, and thank you for everybody being here today. The First Lady has laid out a comprehensive vision for this country, but how we can all come together to ensure that our children are given the chance to live the healthy, vibrant lives that we know that they deserve. As you've heard from the numbers today, the stakes are very high. The CDC now predicts that 1 in 3 kids born today will have diabetes in their lifetimes if we don't change course. So it's going to take all of us, parents and teachers and doctors, businesses, community leaders, to come together to really solve this issue once and for all. And the First Lady is working very hard to bring people together to accomplish those goals. One of the pillars of her initiative is empowering parents with information that they need to make the best choices for their family. And she's worked very hard on this, and with Secretary Vilsack's leadership at the USDA, MiPlato, the MiPlato initiative, is a tremendous tool and resource for parents and chefs alike all over the country to have a framework in which to innovate and create, but in a way that can actually support the health and well-being of American families. So it's too hard right now for American families to juggle all of their jobs and needs of raising kids without giving them the basic tools to help guide those decisions. And so we are very excited. I'm very excited about this framework and to watch American families and chefs alike create dishes not yet seen to have a real positive impact on our nation's kids. And so we're working with community partners all across the country and chefs like Chef Pepin and Chef Marcella to help make this the most delicious effort, I think, to date coming out of Let's Move and the First Lady's work. So I will like to introduce Chef Pepin to come give a few remarks, and buen provecho.
Muchas gracias. I would like to thank everybody for inviting me to this important event. I'm excited that the First Lady of the United States, our First Lady, initiated this program, something that we Hispanics need tremendously. And today I'm especially grateful that now it exists in Espanol, something that we really need in our own language. They were mentioning how difficult was the pyramid for people that they were born here and raised in here. Somebody coming from a different country is very difficult to juggle with that pyramid. Everything we usually eat it on a plate. So we relate to the plate, and it's simple. Those are the nutrients that we need to survive. So I think it's something that is going to change our life in the future. I have spent all my life talking to Hispanics in this country about food. I have been on TV for over 20-something years. And I know that MiPlato will be meaningful to change our habits and for the Hispanics to see in a different way food and health. So that's why I think this is a great moment for the Hispanic population here. And I'm eager to share all this information with all the moms that I see all the time. And I feel like I should bring this message to them and make sure that they will even become better moms by doing this. So, and this will be the tool that will guide them to do so. Well, thank you again. It's a pleasure. And Chef Marcella.
Antes que nada, un fuerte y caluroso saludo a la prensa de habla hispana. Es un honor estar aquí con ustedes. A little Spanish. And as they were mentioning, the statistics and the numbers of obesity and diabetes in children in this country are heartbreaking. As a single working mother to a 7-year-old little boy, Fausto Antonio, he's in Mexico right now, as I'm here with you guys. it's my responsibility to make sure that he has the nutrition and the exercise that he needs to not be a part of those statistics. I feel honored that the First Lady decided to reach out to our community, to the Hispanic community directly. After seeing MiPlato, I think it's an amazing idea. Chef Pepin brings up such an important point that visually, MiPlato, it just makes sense. We're so visual, and sometimes you just want to do it very quickly. And I know how it is. Like I mentioned, I'm a single working mom, and sometimes it's so easy to just go for the processed foods or the fast foods, but we just can't. We have to go back to that idea of farm to table and cooking from scratch and wholesome foods and try and stay away from the processed things because, like I said, we don't want those statistics to grow. So it's an honor to be here, and thank you very much for having me, and enjoy. Thank you.
Do we have any questions?
Chef Pepin, can you comment in Spanish a little bit about
Sure will.
the
Gracias. Okay. Hoy es un gran día para nosotros los hispanos de este país. ¿Por qué? Porque estamos enseñando a nuestra gente a comer más saludable. Tenemos una gran incidencia de lo que es la diabetes, sobre todo diabetes infantil. Y lo podemos, nada más que cambiando nuestra forma, podemos hacer que los niños sean mucho más saludables. Mencionaron también lo que era el ejercicio. Cada día vemos que los niños menos son activos y están siempre jugando con las maquinitas. Yo vivo al lado de un parque y en el parque los niños llevan maquinitas para jugar. Yo les grito, ¡suelten eso! Es triste que estemos haciendo eso. Natural, la iniciativa de la primera dama, la señora Obama, es hacerlo fácil para que a todo nivel se aprenda. ¿Cómo lo estamos aprendiendo? Con un plato. ¿Por qué? Porque es mi plato. Es el plato que estamos acostumbrados a ver todos los días. No es mi plato, es mi plato. Lo que es porción, cosas más sanas y lo que es información. Yo creo que yo he sido producto de la desinformación, pero gracias a Dios estoy tratando he bajado de libras, creo que es una responsabilidad mía y de todos los chefs salir a la calle y tratar de implementar eso. Comida sana no quiere decir menos sabor. No quiero, bueno, para nosotros los hispanos lo que es el sabor, lo que es nuestra comida, son nuestras raíces. Lo podemos hacer hasta mejor de lo que estamos acostumbrados, no tiene que ser caro, lo que tenemos que hacer es información para saber lo que estamos comiendo.
Since you equate obesity as a serious health problem, I was wondering why, I mean, we didn't see a more aggressive effort to promote healthy food, like, you know, the type of the government had been doing against tobacco. You clearly have a heavy fight against those who promote the consumption of food not as healthy as the one that you promote, especially among kids.
Well, I think it's important to know the total steps that we're taking. This is just one of the announcements today. One of the things that the First Lady has been so good at is working with the industry to put front-of-package labeling to give moms and dads better information about calories, fat content, sodium, and sugar. We're continuing to work with the industry on advertising, on making sure that the advertising is appropriate, particularly for youngsters. We are working very hard with schools across the country to make sure that they provide healthy breakfast and healthy lunch. Youngsters will consume somewhere between a third and probably closer to a half of all of their calories in school. So to the extent that we have less fat, less sodium, less sugar, and more fruits and vegetables, whole grains, and low-fat dairy in those school lunches, we're having a tremendous impact. We're working very hard with very young parents, young families, with our Women, Infant, Children program, to make sure that they have the information and the food package that we provide is more nutritious. Even those who are currently receiving SNAP benefits, Supplemental Nutrition Assistance Program, are also receiving information from us. This website basically will provide information to allow folks to make a good calculation on precisely portion sizes and serving sizes as well. So this icon makes it simple. When you're trying, whether you're eating out or eating at home, you look at your plate, and if half of it's not fruits and vegetables and the other half proteins and grains, then you know you've got some work to do in your next meal to make sure that there's proper balance. So there is a holistic and comprehensive effort, in addition to the First Lady's efforts and Secretary Salazar's efforts, to get people outside, get them physically active. We're working with the NFL and the Dairy Institute to encourage the Fuel Up to Play 60 program. So there's a whole series of things that are being done, and they're being done in both English and Spanish.
May I also follow up? Mexico, a couple of months ago, they banned junk food in schools.
Well,
in an effort to, fight obesity. I was wondering, how appropriate do you think it would be to push for something like that here?
Well, the Healthy Hunger-Free Kids Act that I referred to earlier, the act that was passed by Congress with the President's leadership last year, provides for standards for vending machines that will substitute healthy snacks for less nutritious snacks. In addition, it sets standards for the meals that are going to be served. So we actually have something equivalent to that taking place in the United States. So again, there's so many different parts of this, and Sam Cass has referred to the partnerships that we have over 4,000 local partners and 50 national partners helping us to get this message out.
And we're want to be respectful of everybody's time. Marcela, did you want to say just a couple words in Spanish and then we'll wrap it up?
Sí, creo que ya se mencionó lo más importante, pero siempre hay que recordar la actividad física, el ingrediente fresco, y creo que para mí lo que me ha funcionado como madre de familia es involucrar a los niños en el proceso. Creo que meterlos a la cocina, hablarles de los ingredientes, involucrarlos en el proceso de cocinar, los hace sentirse orgullosos del platillo y los hace mucho más propensos a probar el platillo. Bueno, por lo menos eso me funciona con Fausto. Y igualmente con la actividad, es bien fácil hablar y no participar, pero estar con ellos en el parque, hacer las actividades con ellos, hacer los deportes con ellos. El deporte es esencial en mi hogar con Faustito. Ahí ando yo en la clase de karate con él. Pero ser involucrado uno en la vida de ellos creo que es el paso más importante, porque queremos, como les digo, que no sean parte de esa estadística tan triste los números que estamos viviendo ahora. Con permiso.
Thank you. Thanks everybody for being here.
Thank you. Good job. Thanks.